If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Everybody, welcome to another episode of Talking with Dr. Donna. I'm your host, Dr. Donna White-Carey, and this evening we are going to talk about kids, one of my favorite subjects. As a pediatrician, I love talking about kids, and I am joined tonight with by another fellow pediatrician, so this is going to be a great night. As you know, this may be your first time seeing my show. If it is, welcome. My goal is to build generational health. That is so that we can end the cycle of premature death in the Black community. So I want you all to understand that it starts with our children and moving up to each generation. If we pay attention to the 4 pillars that I've outlined, our mental and emotional pillars, our spiritual pillar, our environmental pillar, we pay attention to these pillars, then we are going to be able to build generational health. That's my goal. That's my purpose. Thank you so much for being here on my YouTube channel. Again, if you have not already subscribed, go on over to YouTube if you're watching this in another space and just hit the subscribe button. I really appreciate it. Tell a friend, come on and subscribe so that every time I go live, you got to hit that bell icon though, and every time I go live, you'll be able to watch my show. My goal is to bring you information by credible folks that will give you the information that you need. All right, as always, the chat function is open and you can leave your questions there. We'll try to answer those questions live. So good morning, wow. It's been a long day. Good evening, Elizabeth. Good evening, Cheryl. Good evening, Sharice. Thank you so much for joining. Every Thursday, you know you have an appointment with your doctor, 6:30 p.m. Pacific Standard Time. All right, let's get to it. You know, we talk about coronavirus, and so we're going to start out with some cases so you can see what's happening here in Alameda County. So we always like to break down our data by age because it's important, and also by our race. So if you look at the statistics from Alameda County, you see that the 18 to 30-year-olds are still winning the race against the number of cases. They have the most cases in their age group. But if you look at their complete vaccination rate, which is that yellow line, you see that they are running pretty low in terms of their number of vaccines that they're receiving. Highest number of cases, almost lowest number of vaccines. We want to change that around, right? We want these young folks to be vaccinated to help protect themselves and to protect the loved ones around them. Let's look at the data by race. So if you look at race and ethnicity, we have our data here. And we're looking at the number of cases that we have in our Black and brown communities. We know that they have been the hardest hit in this pandemic in terms of number of cases, in terms of number of hospitalizations, and in terms of number of deaths. And we can also, again, look at those same groups and look at their vaccination rates. The lowest vaccination rates are in our African American population, followed by our Latinx population. So that tells us we got to do a better job of getting this message out that vaccines save lives. So tonight's show is about peds, about pediatrics, about our children. So let's just look at some of the data for our children. And across the country, our COVID cases in the United States, over 6 million children have been tested positive for coronavirus. That's about 16.5% of all cases across the country in the United States. So that's cases. Now let's look at the cases from last week to this week, right? So I said 16.5%, but the cases have risen. Wrong direction, right? Wrong direction. We don't want our cases to rise, but in our pediatric population, our cases are rising in our children. That's why so many of these things and other things we're going to talk about today in terms of the vaccines and our protection of our children is so important, because the number of children that we are seeing testing positive is starting to increase. Let's look at our pediatric deaths. Now, I don't know if you remember over a year ago when we first started this pandemic, we started talking about how kids didn't get sick, kids didn't test positive, kids didn't die from this disease. Well, with the new variants, we are seeing that it's much easier to spread this disease from child to child, and we are seeing deaths in our kids. Nobody likes to see deaths in the babies. So we have over 200 deaths in our 0 to 4-year-olds across the United States, and almost 500 deaths in our 5 to 18-year-olds across the United States. Now, there is something that you all may or may not have heard of, the multi-inflammatory syndrome that's in kids. And this is a syndrome that causes inflammation of pretty much every organ system in their bodies. And what we particularly are concerned about is that heart inflammation, right? And our vessels, the inflammation in our blood vessels, because that can lead to other problems. Well, over 5,000 of these cases because of coronavirus. Now, we know MIS can happen because of other causes, but because of coronavirus, documented kids who have positive testing for coronavirus, over 5,000 cases. And we don't know the long-term impacts of this disease, right? So as we talk about vaccines and we talk about, the risks and the benefits of it, keep in mind over 5,000 of our children have had this syndrome, direct result of having coronavirus. And we've lost 46 kids across the country because of this disease. So I wanted to just lay the foundation for you as we're talking about kids, vaccines, and boosters. Oh my! I don't know if you guys get that reference. That's from Wizard of Oz. I'm a 70s baby. Wizard of Oz was it. So we're going to introduce our guest today. I'm so excited to have my colleague and my friend, Dr. Jennifer Miller, with us today. She is a pediatrician at East Bay Pediatrics. She trained at Children's Hospital and Research Center, Oakland, which is now known as the UCSF Benioff Children's Hospital, Oakland. Yes, that's where I trained also. That is why Dr. Miller is my friend. Since completing her chief residency, so she finished residency and then she went on to be the boss of the residents for an additional year. She's worked hard in school-based health clinics and adolescent medicine, and for the past 15 years in general pediatric practice. Over the past 10 years, Dr. Miller has served on a number of committees within the American Academy of Pediatrics, including the Planning Committee for the National Conference and the Committee on Resident Scholarships. This experience has put Dr. Miller on the front lines of shaping the further education of pediatricians across this country. Dr. Miller remains committed to the education of our future doctors, as well as to the education of her patients and families. Dr. Miller is married and has 2 children. Let's welcome to Talking with Dr. Donna show, Dr. Jennifer Miller. Hey, welcome, Dr. Miller. Thank you so much for being with us tonight.
Thank you so much for having me. I'm really glad to be here. It's nice to be here with friends.
All right. So I gave some data about COVID across the United States in adults and in kids. So I have some questions that I want to ask you. What are you seeing in your office in terms of the pediatric patients and coronavirus?
So I would say things have changed over the last 18 months. Currently, I'm seeing a lot of worries and fears, a lot of parents that are afraid that their children are sick, but thankfully not that many cases of active COVID. We definitely have seen cases of COVID, thankfully none that have been hospitalized. They've had mild illnesses, cough, congestion, fevers, fatigue, and generally those patients have all gotten their diseases from their parents.
So what do you think about the vaccines for our teens that's available now. What do you think about that vaccine and vaccinating our teens?
I think very highly of the vaccine. I support it 110%. I have a tween, and as soon as we could get it, I took her and she got it. And her friends all did the same thing. They all got the vaccine. I know that it makes a difference. I know that it reduces the incidence of severe disease in kids and in adults. And so I strongly, strongly recommend it. My child has Crohn's disease, and she was vaccinated, but still got COVID. And because of her vaccine, her disease was really mild. So I'm very thankful that I vaccinated her because I know that it is key to her mild illness.
Yeah, that's great. And I think a lot of our families have often asked, well, what if my kid has a chronic disease? Can they still get the vaccine? And to that, what do you say?
I say absolutely. I think it gives excellent protection for these kids from getting chronic severe disease. I recommend it to my patients. In fact, most of my patients that have chronic illness were very eager to go out and get the vaccine when they could get it. So I think have them talk with their doctor to confirm that they can get it, that they don't have immunocompromise that stops them from getting it. But largely, kids with chronic disease can and should get vaccinated.
All right. So when you talk about vaccinating our kids, can they get their routine vaccinations at the same time, or do they have to take them apart? How does that work?
They absolutely can get their vaccines at the same time. When they first rolled out the COVID vaccine, there was some hesitation and medical staff wasn't quite sure. But now it is very clear. Vaccines can be given at the same time. There doesn't need to be any delay between regular scheduled vaccines and the COVID vaccine. So please don't let that stop you from getting your as scheduled vaccines. There is not any interaction between them.
That's great. That's great to know. I know I get that question all the time. So tonight we're also going to do the top 6 kind of updates and the hot topics of this week. And so number 1 on our list of hot topics for this week is that the FDA approved the Pfizer vaccine for ages 5 to 11-year-olds. Now that doesn't mean that it's available right now, but we do know that the vaccine is on its way to being available. So Dr. Miller, what do you think about the 5 to 11-year-old vaccine?
I support it as well. Our practice has been very excited as pediatricians all over the country have been waiting for this vaccine to be approved. So I'm very happy to hear that the FDA Advisory Committee has approved it. I'm looking forward to the CDC doing the same thing next week. And hopefully in the next week to 10 days, we'll be giving the vaccines in our offices all over the Bay Area.
That's great. Now, we know that we're getting ready to hit the winter season. And for our 5 to 11-year-olds, they might be getting this vaccine at the same time that they might also get a flu shot. What do you think? Do you recommend the flu shot as well as the coronavirus vaccine?
I do, Donna. Last year, the preliminary data that was out there suggested that if you had the COVID vaccine, you were less likely to have complications if you had the flu vaccine, you were less likely to have complications from COVID. So I absolutely recommend that my patients get the flu vaccine, and I recommend that all the patients out there listening do get the flu vaccine because it does make a difference.
All right. So our number 2 top story of the week is about OUSD, one of the first school districts in the state to come out with a mandate. And last night they voted that there should be one shot, that ages 12 and up are mandated to have one shot before January 1st. For those kids who don't have that first shot by January 1st, they will have to go into virtual learning. Now, I had an interview earlier today, and I was asked, what did I think about mandates? And to me, vaccine mandates, of course, as a pediatrician, is nothing new, right? We've been having mandates. But for me, the concern really is what's going to happen to those kids who are in virtual learning. Are they going to have the staff and the resources to make sure that those kids don't fall behind? We know that the digital divide is really still alive and kicking in the Black and Latinx community. And so I'm hoping that in addition to this mandate, there will also be put into some more intention into making sure that the kids who are home and in virtual learning, that they will be able to keep up. What are your thoughts about the vaccine mandate?
It's so complicated.
Yeah.
There's so much controversy behind it. I do support the mandate. I know that in America, we don't like to hear mandates, but you're right. In California, especially, we're used to vaccine mandates. I was really happy when Senator Pan passed the vaccine mandate. So in the state of California, your kids have to be vaccinated to be in public school. So I'm thankful for that. But I realize that vaccine mandates are tough, and I'm proud of Oakland Unified for stepping out and going on a limb. But because I do think it's the right decision, but I recognize that it is fraught with controversy. I agree with you. I think that there will need to be more things available for our brown and black students, brown and black families, because the discrepancies are just widening. Every time we have to do distance learning, they get farther and farther behind. And so my concern is if they don't vaccinate because of their fears, they're going to be homeschooling, and we know that our kids are just falling further and further behind, and that worries me.
Yeah, I agree, completely agree with you. Just a reminder, if you have some questions for Dr. Miller, to go ahead and put them in the chat. There is one question already here, Dr. Miller. It says, can the flu vaccine and COVID vaccine be given at the same visit?
It can be given at the same visit. I think those of you, hopefully many of you listening, have already received your COVID vaccine. But I think, as you know, the COVID vaccine does make your arm sore, and you do feel a little crummy, especially in the 24 hours after you get it. And for many people, the flu vaccine does the same thing. So I think if you're going to get both of them, you just have to be prepared to know that you might feel a little bit worse than normal, but you can certainly do Tylenol or Motrin, and that should help deal with the mild symptoms, and you should be back to normal. And then you're extra protected.
Exactly. Dr. Miller, is there anything else you want parents to know about coronavirus or the vaccines that I haven't already asked you?
I just want our families to go out and get vaccinated. I want them to protect themselves. I want them to not let fear keep them from vaccinating their children. When you vaccinate your children, you protect yourselves, you protect your elderly, you protect your kids. And coronavirus is not going anywhere anytime soon. So a decision not to get the vaccine means you're deciding to get the virus. It's going to happen. And if you can protect yourself from having long-term serious complications, you want to go ahead and do it. And the vaccine is the best way to do it. We see that kids and adults that are getting breakthrough infections after they've been vaccinated are mild. And that's the best way to get it. Corona isn't going away. So go get vaccinated so that you're not one of those people who has long COVID.
Right. Thank you so much, Dr. Miller. I know that you have to run, but I certainly thank you for your time. Let's see. There's a couple of other questions. Let's see. What's the doctor's thoughts about the vaccine for children under 5 who are in daycare and preschool? How worried should we be about our little ones?
Thank you for that question. I would say that the other reason we want to vaccinate the kids 5 and up is to protect and cocoon those babies and children that are below 5, that are too young to get it. Each time we add another population to the vaccine pool, we're giving more and more protection to those little kids. So I have a 3-year-old niece who can't get vaccinated, and I want to protect her. So I made sure my daughter was vaccinated. And my other niece, when she turns, hopefully we'll get the other vaccine next week because she's 11, so she'll be able to get it soon. So I would definitely say that the more people are vaccinated, the better protection we'll have for the kids under 5.
All right, thank you. And here's another question. What if you don't want, you're an adult, you don't want the vaccine, but you want your child to be protected? Is it safe for the child to stay at home with the unvaccinated parent, or is it best for both of us to be vaccinated?
Well, thanks for that question, Juliet. I think it's always best for both of you to be vaccinated. I think in this world today, when we go out and we go to the doctor, we go to the grocery store, we go to the bank, or we go to get gas, you run the risk of picking up the vaccine anywhere you go. So I think it's always safest for you to be vaccinated and your child to be vaccinated. I've seen lots of patients over the last couple months who, families were vaccinated. They did everything they could to stay in their house. And then they were exposed to a family member who wasn't vaccinated. And then the mom got it. And then the child got it because they were too young to be vaccinated. So I just think, it's a risky decision. And I encourage everybody, especially like Dr. Donna said, it's the brown and black families, people that are most adversely affected by this virus. And we're the ones that are not getting vaccinated. That's not a coincidence. I mean, that's not accidental.
Right,
that is real. And so if we want to protect ourselves, we have to get vaccinated. And we can't let fear dictate that.
That's right. And I say we hear this phrase, vaccine hesitancy, which I've never liked that phrase. I've always called it justified distrust. We had a brand new virus that a lot of people had never heard of before. We got a vaccine in record time, and we used new technology. It makes sense that everybody was, had questions and were concerned about the safety of this particular vaccine. And then when you add in the mix, the storied history of the misuse and abuse of black and brown bodies by the medical community and the scientific community, well, that's justified distrust, right? But we have been talking for over a year about this vaccine. And one of the things that we said when the vaccine first came out was that we don't know everything, right? And as time will tell, and we will get more and more information. Well, now we have lots of information. We have, almost a year worth of data on this vaccine. We have millions of doses being given for this vaccine. So its safety profile has been shown. It's been shown to be safe. Absolutely. And I want to encourage people to really think about that. Another question is our 5-year-old who has cardiac issues, should we still have her vaccinated? We kind of talked about chronic illnesses already, but just go ahead and maybe reiterate what your thoughts are about chronic disease and getting that child vaccinated.
Yeah, so definitely in kids with chronic disease and with chronic disease should get vaccinated. They are at highest risk for complications from the virus. So it's very important for kids and adults with chronic illnesses to be vaccinated. And I agree what you said about I agree with everything that you said.
Amazing. Thank you. All right. Do kids have the same reactions, side effects of the vaccines as adults?
That's what we've seen so far in terms of the side effects that kids get from the vaccine. Most of the studies have looked at the teens because, we're seeing large numbers of those. But in the preliminary studies to get the vaccine approved in children 5 and up, they get the similar side effects. So fever, a little soreness at the vaccine site, sometimes the next day, some weakness or some fatigue, those kinds of things. And then they're gone within 24 hours. I think most people have heard conversation about inflammation that happens in the heart, and a lot of people are really afraid of that. And so for those people that are aware of that, what I would say is the reason that this vaccine took longer to be approved in kids 5 and up is that they were looking to make sure this vaccine was not causing an increased risk of the myocarditis or the inflammation in the heart. And what they found is that it wasn't, that COVID itself, the virus, causes the myocarditis. And that in people that were vaccinated, their myocarditis, if they had it, was very, very mild.
Great. All right. Thank you so much, Dr. Miller, for being with us. I promised I'd get you out before 7. I know you have another place to be. So I thank you so much for giving us your time and answering these questions. And for you out there who are watching, if you have any other questions for Dr. Miller, you can go ahead and leave it in the chat. If I can't answer it, we'll get the answer for you later. So thank you, Dr. Jennifer Miller. You are now a part of the Generational Health Network. So thank you for being on the show today, and I look forward to seeing you soon.
Absolutely. It was my pleasure. Thank you so much for having me.
Thank you. All right, folks out there, we're going to do number 3, our number 3 of our top 6 things you need to know that's on updates to this week around coronavirus. Booster shots, that became known, right? We already knew that we were probably going to need a booster shot, but now we have information about booster shots. So number 3 is our booster shots. Why do you need booster shots, right? So we've talked about why we need a booster shot. Booster shots are going to help to protect you against the virus. It's going to help protect you against infection, and it helps to protect you against variants as your body and your immune system starts to decrease over time. Now, we are not unfamiliar with boosters, right? We all get a tetanus shot booster every 10 years. That's when we think our body's immune system starts to wane against protection against the tetanus. And so for here in our coronavirus and our vaccine, somewhere between 6 and 8 months, it's recommended that you get this booster shot. So the booster shots have been approved for Pfizer and for Moderna and also for Johnson & Johnson. So for Pfizer and Moderna, those booster shot vaccines, if you're older adult, 65 and up, go ahead. Tell us your real age. If you're 65 and up, it's okay to get a booster. If you're in a long-term setting, like you live in a subacute facility or a long-term care facility, if you have underlying medical conditions, just like we talked about with Dr. Miller, if you have immune issue, you have some chronic disease, or if you're living or working in high-risk settings. So if you work in the hospital, you live in a congregate setting, it's important that right now you go ahead and get your booster vaccine of Pfizer and Moderna. It is half the dose of the original vaccine, like the Moderna is half the dose of your original Moderna vaccine, but it's important for you to get your vaccine booster. Now, if you had the Johnson & Johnson vaccine, again, 18 and up, you want to go ahead and get your booster vaccine. Now, it also came out this week that you can mix and match, right? Who knew? So we were always wondering, can you mix and match? So it's recommended that if you got the Johnson & Johnson vaccine originally, that you get your booster shot. You can get it with the Johnson & Johnson, but you can also match it with either the Pfizer booster or the Moderna booster. So you can get your first shot as J&J, and then your your booster shot would either be with either Moderna or with Pfizer. Now, if you ask me which one of those two you should get, which I know you're going to ask me, so I'm going to tell you, studies are showing that the vaccine that's most effective against this current Delta variant is the Moderna vaccine. And I meant to put a little braggadocious picture in my slides today because last weekend I was blessed to be able to meet Dr. Kizzmekia Corbett, who is the scientist behind the Moderna vaccine. So I'm not just going for Moderna because I met her and spoke to her and talked to her about all things coronavirus, all things Moderna. But because of the studies are showing that it is most effective against this current Delta variant. I'll have to show you guys my picture with Dr. Corbett next week, so don't be surprised. All right, number 4. What's the number 4 thing that's coming up this week that just came out? Lots of stuff happened this week. Number 4 is this no mask mandate or recommendation that is taking effect on Monday. This is a rule that our Alameda County Public Health Department had says we can loosen up in wearing our masks indoors in certain places and in certain conditions, okay? So first of all, it has to be an indoor facility and there has to be less than 100 people in the facility. Secondly, you, as the owner of that facility and allowing people to come in, you have to be able to prove that everybody in that building is vaccinated. And you have to make sure that it's the same group of people coming in. So this kind of rule is going into effect in places like gyms, in places like churches, not so much in restaurants or concerts, right? Because you don't know who's in there. You can't and there might be more than 100 people. You can't verify or haven't verified that everybody is vaccinated. And so it's not for these large congregate settings. It's really more for what they call controlled settings. You know who's in there. You know everybody who is vaccinated, and you have less than 100 people. So that's going into effect on Monday. So if you are in a small gym, that means that you can maybe go into your gym and take your mask off while you're working out. In terms of churches can if you can guarantee everybody's vaccinated and you have less than 100 people in there. But I'm going to tell y'all, I asked Dr. Corbett this very question, should we go back to church? And she said, have you gone back to church? And we said no, and she said, good, okay? So that's from the scientist herself. All right, number 5, what's the fifth thing? So this weekend, it's Halloween. It's Halloween time. I know you guys are going to be out there. You want to trick or treat. You want to take your kid out. Then I want you to keep your masks on, though. I want you to keep your masks on. And in terms of treats, to be safe, you should not allow your children to have anything that is not individually wrapped. And we've known that for years, right? I remember when I was a kid trick-or-treating and they wouldn't let us have like fruit because people were hiding razor blades and doing all sorts of crazy stuff. Well, the craziness continues. So you want to make sure that anything that you give your kids is going to be individually wrapped. If you're going to celebrate and try to be out this Halloween, again, wear masks, try to social distance, try to limit the number of people that you're going to be in contact with, because the Delta variant likes to socialize just like you, and we want to make sure that you are not caught up into a situation where you've been protected but somebody else didn't take the proper steps and now you've been exposed to coronavirus. All right, number 6. Number 6 is we're winding down the month of October. I don't know if you can see, I have on a nice pink t-shirt and some pink beads here around my neck because this is Breast Cancer Awareness Month. And as we come to an end, I want to remind you all, for anyone who has breasts, that includes you men, that's not just women, men, you have breasts too, that you make sure to check your breasts self-exam every single month. That's your number one way in which you can try to protect yourself from cancer or detecting it early, right? That's what we want to do. We want to detect it early. So you want to do self-breast exams every month, and you want to do a screening mammogram, definitely by the age of 40. But if you have risk factors, you want to talk to your doctor about perhaps getting that mammogram performed early. There is a study that I want to tell you all about. It's called the Wisdom Study, and there's multiple different sites that is enrolling for this study. There's a flyer, if you can put that flyer up on the Wisdom screening. There you go. You can see it there. It is a study that is basically enrolling women between the ages of 40 and 74. You have to live in the United States. You have to be a female. And you have to have not had breast cancer. This study is going to basically put people into 2 different groups. One group is just getting your regular screening, and another group where they do much more of a genetic evaluation of your risk, and then they recommend screening based on your level of risk. So look, if you're interested, this doesn't have to do any extra blood draws. They're not giving you any treatment per se. You know, they're not going to give you any medication to try out. Nothing to try out, but I think this is a great study because we do understand that some people have denser breasts. Some people have a higher risk, and sometimes the mammograms are not able to pick up these small breast cancers. So this is going to really help to change the way in which we evaluate for breast cancer. And so I signed up for the study. I'm going to be a study participant, and I want you all to also consider thinking about signing up if it's something that you can do. There's no cost. You're not going to get compensated, and you're not going to get paid, and they're not going to ask you to pay them. So look at if you want more information, you can go right there to their website, get more information about this study, and consider being a part of this study. All righty, so those are our top 6 things of today. I want to make sure that you remember that we are still in October and we have our food of the month. I hope that you have been trying to incorporate more kale into your diet. Last night I sauteed some kale and some spinach together. Just a little bit of salt substitute, not even salt, but salt substitute, and pepper, and my kids loved it, I loved it. So just try to incorporate more kale into your diet. So just another few days left of October dealing with our food of the month. And in November, we're going to come out with another food of the month. All right, let's see. I'm going to pop on here just to see if there's any other questions that have come up in the chat. You're welcome, Carla. All righty, all righty. Okay, so once again, thank you so much for tuning in to this episode of Talking with Dr. Donna. We're in season 2. We're in season 2. So if you've missed any of my previous episodes, here they are right there. You can go to my YouTube channel and click on the episodes and just get caught up with what we've talked about so far. In season 2, we hope that we're going to have a lot more things and information to come for each and every one of you. So again, thank you for tuning in to another episode of Talking with Dr. Donna. You know you have an appointment every Thursday at 6:30 p.m. Pacific Standard Time. If you have not already subscribed to my YouTube channel, I would really appreciate it if you hit that subscribe button and that icon and just give me a like and say, hey, Dr. Donna, thank you for that information. We appreciate it. And I really appreciate if you would share the channel with your friends and family and loved ones, because we aim to really give you great information to help you make best choices for your health, for you and your family. Again, we are building generational health right here, and we want to make sure that we end the cycle of premature death in our community. So thanks again for watching. Thanks in advance for subscribing. Until next Thursday, see you and take care of yourself. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.